Mazin, hi, and thank you so much for joining me for a brief discussion here at WHX Tech. You are an expert of the region, everything that's happening around digital health. You helped with several strategies. You worked for the Dubai Health Authority in the past, and actually, we met, I believe, 8 years ago when all the hype was around blockchain, and there was also a lot of ideas about blockchain for Dubai and the Middle East. What happened to all those dreams?
Wow. I think there is a lot that took place ever since. But might I just first start with appreciating you and the work that you have been doing. My dear, you've been absolutely spot on, amazing. I've been following you for 8 years, watching a lot of your episodes at Faces for Digital Health or Faces in Digital Health. Phenomenal content always. What happened next, or what happened ever since? AI happened, disruption happened. People, the need for cost optimization and operational restructure, and the geopolitical, VUCA world that we are living in. A lot that has happened that made healthcare surface up to be a national security matter since COVID-19. The rise of convenience and the patient empowerment, or let's call it the consumer empowerment in healthcare, has happened. The need for data and the importance of data has surfaced up. Blockchain has been revisited again with the lenses of AI now, which is a far much more justifiable landscape that allowed us to understand really the use of blockchain and cryptocurrency and metaverse within the umbrella of artificial intelligence, going back to basics and the need for data. A lot has happened.
The Middle East and Dubai specifically have always been very ambitious in terms of digital health development. How has that evolved in the last, say, 8 years? Also, given everything that you mentioned, has the interest for startups, the interest for the implementation and adoption of startup solutions, how has that changed also in terms of funding? What are you observing?
So the cycle of digital health maturity has been a journey that began early in 2006, 5, and it started with the run and the chase and the finding of EMRs. It all started with chasing up to find HISs and implement hospital information systems and electronic medical records. Fast forward from 2005, 6, all the way to 2014, people started looking at digital health. What other components that they can add on top of the HIS, the EMR, the LIS, and started thinking about health information exchange. What does that mean to us? So the maturity started pivoting into the health information exchange and the interoperability and the integration of the different systems within the healthcare environment, and looking at how you can create seamless flow of data. 2020, 2020, we get COVID-19. The rush for digital transformation across healthcare has become a huge need and a critical need for the survival of the health ecosystem. And we started seeing the rise of the convenience, the patient becoming the important center focal point for healthcare. Not only the patient, but even the word consumer, the word customer within healthcare, and the surrounding ecosystem, the family and whatnot. And then we started seeing a lot of focus on value-based care, burnout, and people started looking at mental health. The maturity of the workforce has shot up so much that the mental health has become a risk factor. So now we're looking at the whole ecosystem from different angles. The amount of data that has been generated in the first phases of the EMR and the following phases of the health information exchange and the digital front doors and the concepts of patient portals has culminated into this complex ecosystem. So I think now we are trying to rationalize this, and with the use of data that we have, the maturity of AI algorithm and the maturity of the stakeholder ecosystem, because the maturity of the investment mindset, the maturity of the startup and innovation mindset is also been gaining momentum. We're still, I think, missing a link. We're missing the depth of the research that healthcare requires. We're not comparing ourselves to Boston or the Golden Triangle yet, but we are pushing towards there. We wanted to create more depth into health systems because we have talent scarcity. We have a burned out healthcare workforce. We have infrastructure that is yet to mature up when it comes to research and building. AI is a research-driven super economy that we haven't yet investigated the depth of it in the Middle East like they do in the US or the Southeast Asia region or European region.
So still plenty of untapped opportunities.
Absolutely, and you can see here, look at the landscape of the attendees. Academia is still shying off from the role that they need to play. If for us to be the likes of the Boston or the West Coast, the Silicon Valley mindset, ecosystem of investment and research, we need to mature up in the research part. We need the science to come and play with us. We need academia to be here and drive a healthcare that is built on transactions and commercial dealings into a depth, long-term driven economy.
Mm-hmm. What people that know the ecosystem here like to emphasize is that, when it comes to the Middle East, countries differ, so don't confuse the market by thinking it's unified. And my question is even more local. How would you say that the development in Abu Dhabi and Dubai compare? How do the cities differ in terms of their approach to healthcare digitalization? Their infrastructure is a little bit different.
Sure.
The timelines are a little bit different in terms of when the Malafi Health Exchange was introduced and how Dubai approached the introduction of EHRs.
So I believe Abu Dhabi is leading a lot of the way because of the aggressive approach into investing in the depth of healthcare by investing in pharmaceutical life sciences, biomedical sciences, and research. Abu Dhabi is definitely putting a lot of initiatives and driving this not just with financial resources, but also trying to push academia to follow industry. We are blessed in this region, both in Dubai and Abu Dhabi, with leadership that has a very long-term vision. And that is very evident when you look at the different industries that we have. Healthcare, there is a lot that needs to be unfolded in to be in comparison with aviation or energy sectors or retail and consumer sectors. So I believe the vision in Abu Dhabi has been struck on a longer term to try and build the infrastructure, not just the financial and not just the research, but also the talent pool and bring in more and more attractiveness to create the depth. Dubai has been also trying to push the envelope by allowing the private sector to play in this government-driven initiative ecosystem, where the governments are putting the visions, but then the private sector in Dubai is being given more leeway to try and push the envelope and demonstrate and test more. Like the model we have innovation, fail but fail fast, right?
Yeah.
So, this is, I think, the complementary approach between Dubai and Abu Dhabi has allowed seeing what Abu Dhabi is researching in and diving in when it comes to investment, but also the playground is in Dubai, where they are testing it with the private sector, the huge dominance of the private sector, plus the international brand that Dubai has and the different visitors and passengers that pass by Dubai being a very transient location, allowing Dubai to be a playground for testing, innovation, and driving Abu Dhabi from the depth of the healthcare.
Yeah.
So one is looking at the breadth or the width, and the other one is complementing it with the depth.
How would you say that the region manages where innovation happens? how much rivalry is there between places and, also trying to make other places more international? Is the interest there for the talent pool? And maybe you can also expand to other countries in the region as well, because I know that you've been advising on digital health strategies beyond just the UAE.
Sure. So I believe the rivalry has become a pivotal point for complementing the growth, in the sense that Saudi, Abu Dhabi and Dubai and Qatar, they've become the quadrant of infrastructure and the quadrant of innovation. Those 4 different jurisdictions, and I purposely mentioned Abu Dhabi, Dubai, Saudi and Qatar to be the leaders, and now obviously Northern Emirates as the fifth element as well, that comes into this amazing innovation hub, driving financial resources, driving talent acquisition, driving innovation and whatnot. So I believe the rivalry has created not only different angles to drive innovation, but also challenge the maturity of innovation, investment and research. Saudi is doing quite a lot, being a big population country with many organizations contributing from the private sector and the public sector, and the rise of the family offices, the venture capital organization, the PEs, the private equity and the sovereign wealth funds across all these 5 jurisdictions are playing a big part. The beauty of this equation, this 5-angle equation, is that now we are trying to make sure that these models are exported to heavily populated countries, Egypt, Turkey, Ethiopia, Uzbekistan, Kazakhstan. Now they are trying to commercialize and customize these models to fit in heavily populated countries, creating new markets. We're working on West Africa. The amount of interest that are coming out of Saudi, UAE and Qatar to export digital health success stories into West Africa, which is a huge growing region when it comes to economic growth, population rise and political stability. So this has become the norm. Build it here, test it out here and export it out there. And I think that has brought in a lot of interest into Africa, the CIS countries. Southeast Asia is also becoming a battleground for innovation.
In Europe, we like to say that it's very difficult to scale to other countries because they have different languages, different healthcare system. What would you say about scaling across countries in the Middle East? What are some of the misconceptions that you're observing? What would your advice be to companies that are trying to succeed here?
Absolutely. So I think Europe, there's more homogeny in the economic zone in Europe, more homogeny than the Middle East. We are very fragmented, but yet we have a much more growth due to the economic vision of the leadership. With a zone like Europe where homogeny is already there, I think you guys are shooting yourself in the foot when it comes to over-regulating. And that's why the innovation is running away into the Middle East. And again, I work in a number of accelerators from Poland to Estonia, the Baltics, the Eastern European countries, looking at also the Balkan countries that are also becoming a fertile ground for innovation. We're seeing a lot of movement into the Middle East because of the least amount of regulation that we have. And that is creating a haven for testing. What we lack here is the research component that the European economic zone has, and they are still very intact and very strong in driving the depth of healthcare. Unfortunately, what I see is Europe has to start thinking about the regulation from an innovation point of view to try and lessen the regulation. The diversity of the European economic zone is huge. The innovation and the research is very deeply engraved within the economic zone, as opposed to the heterogeneous Middle East with so much fabric, so much fragmentation, but yet so much long-term and stable government vision. You see the pros and cons? We still lack the research capability that you have in the European economic zone, but we can benefit from the homogeny that has been created across the whole European Union and the talent transfer that you have and the production, not just the transfer, but also the production of talent. That's what we need here. The role of academia, the role of actually creating more homogeny. Regulation part, I think we've done better than Europe in deregulating.
Yeah.
Right?
You know what's interesting? Some people I also spoke to who are maybe not based in the region but do a lot of work in the region said that what the Middle East could benefit from, looking at Europe, is an EHDS approach in terms of the data sharing.
Absolutely.
So how do can you explain how the interoperability works or doesn't work in the Middle East, and how the different countries or regions approach just data sharing, so we can understand where that thought comes from?
Sure. So again, we started, if you look at the interoperability cycle of maturity within the Middle East, it started in islands. So Abu Dhabi started their Malafin, they've grown in maturity. Dubai have their own NABID, Health Information Exchange, and their own maturity level or maturity cycle and journey. Northern Emirates, under the jurisdiction of the Ministry of Health and Prevention within the UAE, have their own interoperability program that is also growing in maturity. Saudi Arabia, being the biggest heavily populated country, started their own health information exchange to drive a unified approach for seamless data approach. But then we have the data governance and policies that have been created in Saudi. We have similar data policies and governing regulation that has been created in the UAE on a federal level. And then you have also Qatar looping in their experience within the data governance and the interoperability. I believe now in the Middle East we have initiatives that are asking us as different islands to pivot, allowing us to look at interoperability beyond the borders. 3 years ago we started the discussions, and now the use cases have been put in place. Pilgrimage in Mecca that happens every year is a fantastic use case to allow different jurisdictions talking to each other in order for data seamless flow between different countries, specifically for the high-risk patients. So we're seeing use cases being developed, funneled in with AI predictability use cases as well, that allows, as patients are moving between countries, allow the actual monitoring of those patients, specifically when it comes to pilgrims. It becomes to obviously the movement of patient when it comes to medical tourism, or the movement of patient when they are actually transferring due to economic initiatives and whatnot. So I think what the data policies have set up on the basis of what we've learned from Europe, the GDPR or the HIPAA compliance, and we've kind of mellowed it down a little bit by deregulating it and making it less restrictive, allowing us to do more data interoperability. But what I think we can do more of is allow academic institutions to come in. So the concepts of data sandbox.
The data
Absolutely.
For research.
A data space.
You know what I think is very interesting about the ecosystem that you described, where basically you've got different approaches to healthcare information ecosystems and information exchanges. Years ago, most people that work in the Middle East said that the biggest advantage of this region is that it's hungry for innovation and it can leapfrog the innovation chasm because there's no legacy systems. But with the fragmentation that we just mentioned, you basically did kind of all the same mistakes that everybody does. And I also see that in Africa, where people say nothing's there, so we can just use the best things.
Sure.
But when you talk to people that are designing EHRs, you realize that everybody wants to do their own thing, because the existing solutions are either too expensive, there's no requirements in terms of data standards, so people end up doing their own thing.
Sure.
Nothing is really connected, and it's the same problem.
Absolutely.
So I'm kind of questioning this whole idea of the possibilities for leapfrogging. And I'm curious to see what's your take on that.
I think, and that's a very interesting question, because you can leapfrog by buying out of the box technology and implementing. But before you do that, you need to think about customization and personalization of those within your culture, within your geography. And before that, even that, what is the role of R&D and academia that allows you to make sure that you build a sustainable adoption model for these technologies? So leapfrogging by buying off the shelf technology and implementing is doable. But sustaining the adoption and the impact, you would need certain players to come in to actually help you into the sustainability of that. We have the regulators who are they are very forward-looking and forward-thinking by enabling us to keep the regulation at the lowest level of restriction. They are thinking ahead by putting strategies, and this enables us to build some sustainability. The missing part, I think, is basically whatever you collect from data and whatever you do whenever you have a deregulated environment and you bring in these technologies, what are you going to do to sustain the cycle of innovation? You need academia. You need people who can roll their sleeves and play around with this like a Lego piece and start building more products, more services on top of it. Leapfrogging with technology, adoption, implementation cannot be done without a forward-thinking regulator and a proactive academic institutions and researching entities that allows the sustainability of adoption. If that makes sense.
It does. Thank you, Mazin, for all the insights. I look forward to keeping in touch and following up in, I don't know, maybe 5-10 years time, and we'll see how far the vision has come. Far for sure.
I hope to see you very soon. I hope you don't leave it for a few years. You should come in GCCE Health Workforce next month, or the Global Health Exhibition
because
in
that's
October.
The speed of innovation.
That's right, exactly. You need to be here every month. We need you here, Tasha. We need faces of digital health. Yeah. Back to the Middle East every month.
Wonderful.
Thank you. I'm so sorry.